Assalamu alaikum, respected faculty members. I am Hafsa Binte Imran, a final year BDS student from Karachi Metropolitan University. This presentation has been completed under the supervision of Dr. Mehwish Kashif with co-supervision by Dr. Shiraz Abbas. Today I will be discussing how the oral cavity can reflect a patient's lived experience beyond teeth and restorations. I would encourage you to focus closely on the images used throughout this presentation as they are intended to visually support each concept. Relevant references have also been added on the respective slides to support the content discussed. Not all suffering is verbal. Patients may not always share what they are experiencing. Silence in the dental chair is common. However, oral findings develop over time and can reflect concerns that are not verbally expressed. Dentistry therefore requires us to pay attention not only to what patients say, but also to the clinical patterns their oral tissues reveal. Mental health leaves oral signs that includes bruxism and erosion. Bruxism is commonly associated with stress and anxiety. Psychological tension increases muscle activity, leading to involuntary clenching or grinding of teeth, often during sleep. Dental erosion can also be linked to mental health. In some individuals, emotional factors such as fear of weight gain, body dissatisfaction, and low self worth can lead to self induced vomiting as a maladaptive behavioral coping mechanism. Repeated exposure of teeth to intrinsic gastric acid results in enamel erosion. These patterns are well documented in dental literature and highlight how emotional distress can manifest orally. Moving on, we have some patients that cannot speak for themselves, particularly children, that are unable to recognize or communicate what they are experiencing. Early childhood caries and poor oral hygiene beyond age appropriate levels may indicate unmet care needs rather than isolated dental problems. In such cases, the oral cavity may provide important clues to neglect, limited supervision, or barriers to accessing care. Then we have excess shapes oral health outcomes. This timeline shows how limited access affects oral health. Delayed appointments allow disease to progress. Without timely care, decay remains untreated, leading to irreversible tooth loss. These outcomes reflect delayed access rather than lack of effort and contribute to long term public health consequences. Then we have addiction that records itself orally. Addiction often leaves recognizable oral signs. Tobacco use may lead to periodontal disease and mucosal changes. Alcohol can cause dry mouth and erosion. Stimulants reduce saliva and increase bruxism, leading to rapid decay and tooth wear. Cannabis use is associated with xerostomia and increased caries risk. These findings are not random. They reflect long-term substance exposure and behavioral patterns. Moving on, we have injuries that tell a different story. Recurrent dental trauma, fractured teeth, bruised lips, or injuries at different stages of healing may suggest non accidental injury. In cases of physical abuse, patients may try to hide the cause due to fear or shame. Dentists are often among the first healthcare professionals to observe these signs during routine examinations. Oral tissues record lived experiences. Oral tissues change slowly over time. Long-term stress, daily routines, chronic illness, and repeated delays in care leave visible effects on the gingiva, mucosa, and dentition. What we see clinically is not a single event but a record of lived experience. When patients stay silent, the mouth still speaks. Throughout this presentation, we have seen how oral findings can reflect emotional distress, behavioral coping, addiction, trauma, neglect, and barriers to care. These are not isolated dental conditions. They are patterns shaped by lived experience over time. As dentists, we are often in a unique position. We may be the first healthcare professionals to notice these signs during routine examinations. This places a responsibility on us to observe carefully, think beyond symptoms, and respond with sensitivity within our professional scope. The take home message is clear. Dentistry is not only about treating disease, it is about awareness, responsibility, and care. By recognizing what the mouth reveals, we can move towards a more holistic and compassionate approach to patient care. Sometimes the most important thing a dentist can do is notice. I would like to thank the organizing committee for their efforts in conducting this presentation session. Thank you so much.